Hello, folks. Welcome to the Moc Pod with your host, Jordan Brown. It's just me this week, a little shorthanded. Same with the interview. We have an amazing interview coming up with Dr. Meagan Dwyer. I think in the interview, I never announced her as Dr. Meagan Dwyer, but she's a doctor. She's legit. She has a ton of experience working with people in the oncology kind of spectrum of therapy, survivors and supporters. So I'm not going to waste your guys' time. We're going to get this interview fast. And so with that, hi, everybody. Let's get to it. We're here today with Meagan Dwyer. I'm happy to introduce her. She's a psychologist that I met through our foundation work. She has a private practice here in Kansas City. So we're going to talk to her today. She has 13 years of experience dealing with patients and families with complex issues such as cancer diagnosis. So we want to hear from her today. So here she is. Hi, Meagan. How you doing?
Awesome. Well, thanks so much, Jordan, for having me. It's a real pleasure to be on the show with you today and hopefully answer some questions and get people some information about how therapy can be used to support people who are going through cancer, be that a patient themselves or their caregivers, family members around them, because we know that there's that ripple effect that not just the patient in the chemo chair gets impacted by what's going on.
Yes, correct. I was thinking the other day, it's like, I think a lot of the thing is I love having you on here, someone like you on here, because it kind of puts a face to the therapy. I think a lot of the reluctancy sometimes with people, I think even myself at times was like, who am I going to see? If I can't talk to my spouse or even my closest support person, how can I talk to a stranger sometimes? That kind of comes up in their head a little bit. So it's nice they get to see someone and kind of, understand that it's a person and they can talk to them. So I like that too.
That's scary.
I know. I'm not terrified. We met with for the first time.
I don't have like 12 eyes or anything. It's shocking.
You never know.
Right.
You walk into a room, you're like, I'm going to walk back out now. We're not going to do this anymore. Yeah. It could happen. You never know. It could happen. So I guess I kind of want to say a little bit about yourself, but kind of explain your background, to the viewers and, with obviously cancer patients and their supporters. Love to hear about that.
Sure. So I'm a psychologist by training. So I have my doctoral degree in psychology. I did my training primarily focused on the intersections of trauma and health. So wanting to understand kind of how our lived experiences impact our emotional well-being and our physical well-being and kind of how those things went together. And so I did my PhD work at St. Louis University and got exposed to working with people with chronic illness and some different things. And then on my internship down in New Orleans, actually, I had the opportunity to help run a support group for cancer patients and survivors. And I had never done that work before. I'd had some experience personally with people I knew in my life with cancer, but never done it in that like professional realm. Mm-hmm. And so, being a good little intern, I was like, I want to get as many experiences as I can. I went to that group, listen to those survivors and patients talk to each other and support each other, and saw the work that the therapist, the psychologist leading it was doing, and walked out and was like, I don't know what I thought I was going to do in psychology, but I want to do this thing. Like, this is amazing. So I kind of dove into getting more training, doing anything I could do in that realm, came back to St. Louis at Siteman Cancer Center, which is part of Barnes Jewish Hospital, and Wash U School of Medicine, and was able to do a fellowship there that was, a whole year, just really intense in the cancer realm. Mm-hmm. And then I came back to Kansas City. I'm from the region originally. And so it was nice to come kind of closer to home. I never thought I'd be working close to family, doing what I wanted to do, because when I was growing up, we didn't have, a nationally recognized cancer center in the area. So I was able to come back. It was awesome. And I was on faculty and ran the oncopsychology program at the KU Cancer Center I was on faculty there for 11 years. And then it's intense work. I loved it, but I wanted a little bit more flexibility to follow patients maybe longer. We only could really follow acute cases and for my family and stuff. So I decided to go out into private practice. But my practice really, a lot of patients I was serving continue to come to see me and find value in that. And then, sorry, I'm getting a little critter visit.
The kitty's there. It's fine.
Edit him out. And so I would say probably a good 70 to 80% or more of the people I see still are people who have been impacted by cancer. Yeah. So they've had cancer themselves. Someone in their life has. They've lost someone to cancer. I have a few people with other chronic illnesses like MS or Parkinson's disease, some other kind of rare conditions. And then I have a few other people who I'm helping with more general things to kind of round out, give myself a little variety and stuff.
Yeah,
but
of course.
So that's the real core of the work I do.
Yeah.
And then a little plug, I'm also really involved in an organization called APOS, which is the American Psychosocial Oncology Society. And they are kind of a group of providers who, social workers, chaplains, psychiatrists, physicians, psychologists, like who work in the cancer realm and do a lot of the research on how to support people and guidelines to give out to cancer centers on how to support people. So I feel like it's a nice way to be engaged in the front end with the patients directly, in the back end through the organization, and trying to develop and disseminate really good information about what people need.
Yeah. So, and we talked about that when we met the first time.
Yeah.
About them. And that really, kind of struck with me too. I'm like, you're right, because, there's a big difference when that diagnosis comes down about how people react and what you need to do for them, because it's not really the same. And it just kind of hits a different nerve with people, so it was nice to hear there's an organization out there that's trying to kind of curtail a type of therapy or, that experience for those people that are going through that,
Yes.
I think it's very important.
And developing some trainings, because as going through this and probably educating yourself with your foundation is how many people are impacted by cancer. I think the statistics from the American Cancer Society are that, 1 in 2 men and 1 in 3 women will experience a cancer diagnosis if they live their full lifespan, right? If you live to be 80, that's a lot of people, right? And that's a lot of people. It's going to touch everyone. So I think mental health providers also, we're going to encounter someone with cancer, whether you specialize in it or not. And so I like that APOS is also offering an online virtual academy. So if you're in the mental health provider realm, or someone who is, they have online training academy that you can do at your own pace. It's CEs, but to help you become a little bit more well-versed. Because that's something sometimes I find from people who end up with me is, I was seeing someone, but I got cancer and they didn't really know how to support me the best. Or I've had a really hard time finding someone who has experience in working with cancer. And, as much as I'd like to help people, I'm a one. And so I would love more people to know there's that training is out there.
Yes. Yeah, I agree.
And it's reasonable. I mean, it's not a for-profit organization, right? We want the training to go out. So
definitely. Yeah. And I've had that question from people who applied to us, kind of wondering this person that's going to help me, or the people that you're recommending to me, they know about, cancer patients. I'm like, of course. That's what kind of I'm building this thing for. But it's a legit question to ask. And I'm happy that I was able to kind of recognize that myself beforehand, because I would have been like, if they're like, I want someone that's actually, deals with cancer, I'd be like, I don't know what to do now, so definitely a big difference there.
Find that needle in the haystack together, right? Like, how are we
we'll look around real fast for sure. I think that your expertise in the area is awesome. Good person to lean on for us. I have at least, definitely. And then it kind of rolls into the next question too, of where you are now, and then also with the uptick in mental health awareness. That's kind of where we are now, right? This is kind of that new era in mental health. I feel like has it changed the amount of people that reach out to you in your 11-year span, and then obviously people dealing with cancer specifically in that kind of area. That's what I'm talking about.
Yeah, I do think there's so much more, not just awareness, but I think people, and though there are definitely like all avenues, right? All social media, be it podcasts and like TikTok and Instagram and stuff, like people are, I think, a lot more open about therapy, what it looks like, how people can benefit, what their experiences have been. I think sometimes there's that fine line between what's helping people get access and then what is like diluting things, or maybe everyone thinks like they can diagnose themselves off of something. So I always say, like, still go to a professional who's had the training, make sure you look at that person's credentials, and so forth. But I do think that the people aren't as shy to say, I see a therapist, or I've been to therapy, or I'm working on this, which I think is great. The stigma around it, I think, has gone down. Although I will say I've had a few times like in conversation, people who are like, oh, well, everyone should have therapy. And while I do think there are aspects like for everyone can benefit at some point,
yes,
maybe not at every single point in your life is it like needed.
yes.
If you're going through something really hard, if you're struggling, if you've had a longer standing diagnosis that you need supports for. But, therapy is not just a venting session. It's not just just to go and just like spill our guts. It's not a friendship. It's a really different relationship.
Yeah.
So I have seen sometimes where maybe because people hear, oh, I ought to be doing this, it's really good, that maybe they don't know how to use that tool well. And we have to do a little bit on our end as therapists to kind of educate people about what it looks like in real life, not just on your like TikTok screen.
In the fantasy world or whatever. I agree. Well,
or
I guess
different shows that.
Yes.
I mean, if you have ever had a profession you've been in that's been portrayed in media, oh my gosh, that's not my profession. That's how I feel about like how therapy gets portrayed.
Don't get me started on TV and movies. We had a convo on the pod, I think like 2 episodes ago, and I brought up the thing about, I said, what really irritates me is when they put cancer into shows.
Oh my gosh.
am so, and I never thought of it. Every time it happens, I look over at my wife and I'm just like, oh, he's sick. I go, but he has cancer. We want to bet. It's like, oh, he has cancer. I'm like, you're writing that in. Like, can we just, and it's
or
almost
the person walks into their first ever chemo already bald. You're like, wait,
you
can tell whoever's writing has not experienced this, unless like there are a few good examples out there, and when you come across them, you're like, oh, whoa, somebody who was involved in that really gets it, but it's rare.
It's very rare. It's very rare. I think it's kind of a lazy writing tactic in Hollywood. I think definitely feel that way, but they just use it to Is
AI writing this? No.
yes. I'm like, who's actually doing this here? And I like what you said too about people going into therapy. It is work, and that's something I realized when I went in, and I kind of when I went into therapy. I told you about this. It's post treatment, kind of everything slowed down. I was like, whoa, like everything's done. Now what? The anxiety kind of picked up, but I went in there. I told my therapist what was going on, but also, it was like, hey, but we need to work on these things. We need to put some work in here when we're recognizing how we feel and what we need to do to make that better. And not just going in there and being like, oh, so I feel, and then walk out and have a good day. There is some work involved.
Yes. Oh, thank you.
Realizations.
And we as therapists, like any psychologist, social worker, marriage and family therapist, like whatever your credential is, we're never effective if it's only what happens in that 1 hour with us, 1 hour a week, 1 hour a month, whatever you are doing. So much of it is taking what you're learning, what you're working on, reflecting on that, trying different coping strategies, putting it into practice in your life, because your life is so much broader than that little experience. And so I do think that's important, like coming in, being willing to be open. We can only help with what you're willing to share with us. We'll help open some things for you and help you gain some insights about self, but also being willing to try some new things, to do something different. Oftentimes if I'm feeling stuck with someone, I'll kind of lean into like, well, and we have to lean into this for ourselves too, of like, well, if you're not happy with what's going on and it's not working well for you, maybe what you're trying, maybe you've given it the old college try and like that's gotten you as far as it can get you. And now we have to do something different.
Yes.
Because if that was going to work, it probably would. It's not effort or you didn't try it. It just, maybe we've maxed out that way of coping or that style of interacting or that way of managing our emotions. And so kind of change and putting in the effort and the work is a part of the process for sure.
Yeah. It really is. I mean, it's like you said, it kind of goes back into that dramatization of it. It's not what you think it is. You have to walk in there and put in that work for sure. I do agree with that 100%. But this question here, it's kind of a two-parter, and so other than having cancer, and what that entails, health-wise, prognosis, everything. What are the other stressors that you see amongst individuals and their supporters? Other than just like the the normal monotonous of going to the chemo, dealing with the doctor's appointments, the scans, all the normal, I get my 6-month scans, stuff like that. What else do you see around that that affects,
I kind of think of it as like the protocol stuff, I have an appointment, I have this, the side effect, like the things that are all really lined up with your treatment protocol.
Yes.
And then you have like that ripple out of missing work. And what does that mean? Not just financially, I think something people forget is, and we saw this a little bit during the pandemic, is work. Yeah, it's our financial stability, maybe. But for now, for cancer patients, they're freaked out about missing work, not just because of, will my paycheck be different, or do I have enough leave? I need benefits, right? I have to have that insurance, like more than I ever imagined I needed it. So they're stressed about that. But also our work's a big part of our life. It's a big part of our identity. You go to a dinner party and meet new people. And we often ask each other, where do you work? What do you do for a living? It's how we describe ourselves. It's a set of skills we have. It's what we do every day. It's the people we interact with. So when you're sick or you're at treatment and you're missing that, it's kind of like you're losing a part of yourself by not being at work, even if I don't feel well enough to be there, even if your company and your colleagues and coworkers are completely supportive and cheering you on, doing everything. It's still this huge life change of like what your life has been evolving around. Time away from your kids. Maybe if you have to be cautious with your immune system, you can't be as involved, or, go to that school assembly or go to the things you want to go to necessarily. Maybe you don't always feel up to going out with your friends and socializing. So I think it's kind of the way cancer or really serious illness too, I see, where it kind of erodes and pulls us out of our normal life. And really when I hear people say, I don't feel normal, it's like, I don't feel like myself because I'm not doing, or I'm not able to do the same things that have really defined me, those things that I really value.
Yeah. Yeah. I think, the work thing is interesting to hear because, people hear it all the time. Man, I could quit tomorrow, I would, or if I'd retire, but if when it gets taken away unexpectedly, it's way different, and I think you realize just how much, if you're just to say you're there for 40 and 60 hours a week, in that, right? That's gone. That you take that away. What did you replace that with? And if the answer is nothing, it's kind of like you're just out there, looking for something new.
Right.
Yeah. It's, the amount of it kind of changes everything. I think for me too, as well. I think the relationship part of it with friends and stuff. The other thing with that is that you kind of don't want to be around them, and not because at first, because you just don't really want to like talk about it sometimes what you're going through. And I always tell people all this time. The other day I was having a conversation with somebody, dealing with cancer, and I was talking to him, and I said, "How you doing?" And I said, I was like, I'm so sorry I asked that. I was like, I can't stand when people ask me that question. I really can't. It gets so like, and I understand you're asking a question out of the kindness of your heart, and that is the right thing to do.
Right.
Like, you're not wrong for asking the question, but when you're going through what you're going through, it's like, how do you want me to ask the question, man? How do you think I'm doing? And so
I always say they ask that question like we all, like right now, if I walked outside and ran into my neighbor, I'd probably say that. How are you doing?
Yes,
right.
Exactly.
But when you're dealing with cancer, we know that people like they put on the puppy dog eye.
Yeah.
And it's like, how are you doing in italics, right? Like, how are you doing? Oh, you bored. Like, Also, for many, especially younger cancer patients, maybe they'd love to take more time off work, but they can't for various. They still have like kids don't stop and housework doesn't stop, and like nothing really goes on full stop. We have to pull back a little bit, but nothing's like necessarily gets to stay paused.
Yes.
So they do have other things going on in their life. I have found for a lot of people, I think when we talked, maybe I gave this example. So I had a woman years back that I worked with, and she was kind of annoyed by the same thing. She was supposed to be meeting some friends for lunch, and she was like, I just know they're going to look at me like I'm just a cancer patient. And then they don't want, and some of them had kind of shared with her on the side, like, oh, I hate to bring up or complain about this thing at my work because gosh, you're going through cancer. Or I don't want to complain about my, my kids and my housework because you're going through this big thing. And she's like, I want to know what's going on in your life. Like, I don't want this to be the center of the universe for me. So we had her play a game, and they all got involved, and they were really good sports. And it was more to prove a point than they actually had to do it. Is she set a timer on her phone, for 10 minutes. And she said, we sat at the table and she's like, if you guys can ask me anything about chemo, about treatment, about my doctor's appointments, about whatever, about anything cancer related for 10 minutes. And when the timer goes off, if anybody says cancer or alludes to it, they buy a round of drinks.
I'm about that one.
And they all laughed and they did. And she goes, actually, we got through the questions in 4 minutes because when they all realized, and I think for our friends and people around us, sometimes they don't want to be the a-hole either, right? They know this is going on and they're like, it'd be insensitive not to ask about it. I don't want to make it focus. And I do want to ask about this thing or bring up this thing that's going on with me, but I don't. So I think laying that groundwork in whatever way fits you of saying hey, here's the update. And then let's move on. I want to know what's going on with you. Or I also want to vent about this completely unrelated thing.
Yeah, because life still goes on.
Right.
The person that has cancer, they still have a life, and they still have issues going on outside of cancer. I mean, that's how it works. Unfortunately, everything doesn't stop, and then just cancer is only happening now. I mean, it's just as simple as that.
Yes, exactly. So sometimes I think communicating that, and I hate that that gets put on the shoulders of patients, but I also know when you're in the driver's seat, you can kind of guide it where it works for you. So that's something I encourage people is just kind of set that boundary or that expectation with friends of you can ask me a few questions or I'll give a little update and then let's move on. That's not everything. Yes. And I find a lot of times the people around, the friends, colleagues, whoever it is, they're just okay, now I know what to do. Now I know how to act.
You don't have to tell them how to act, which is fair because, I mean, you can't expect someone to know how to act when they're not, you know what I'm saying? You can't just know, maybe someone's already been through it before with the family member, in the past, they kind of learn how it works. But if you're new to it, they're not going to know how to react, just how it works. I mean, yes.
And people can surprise us of maybe people who are close to us who really don't know what to do because they may be scared. They may not know what to do. And so, I think just breaking that, here's what to do that can help everybody.
Yes, I agree. I think it makes the kind of relationship healthier too, because it kind of, because you're not anymore when they're trying to tiptoe around you and they don't want to also vent to you. They've probably been venting to you for 20 years as your best friend or whatever. And not venting you no more, where's my best friend now? It's just, the whole relationship changes. So it's really important to make sure it's still healthy at the end of the day.
You need that. And you need a break because cancer, gosh, no oncologist even wants cancer to be the center of your life, right? Yeah. They want to manage this and help you get through it. We all do. So the more we can give patients tools and the people around them to say it's something going on in my life, but it's not the title of the Jordan Brown book is not Jordan has cancer, right? That's a chapter, or maybe it's just a couple pages in one chapter.
Yeah. Okay. And that's I think that's what we were other day. We were talking about mottos for the foundation. Short. I think though I can't really allude to exactly how I put it exactly, but was to where you have cancer, but cancer isn't you. And that's really important. Yes, you have cancer, but cancer is not you. You're still you. You're still the person you want to be. Because unfortunately, what happens is a lot of times I think that for the first whatever it is quarter of that, cancer diagnosis, it's your cancer. That's how you kind of feel. That's how you make yourself feel. And that might go into the fact that you're literally when you first get diagnosed, you have a doctor's appointment every 3 days, and you're seeing 5 different doctors. I mean, it kind of does become you for a second. But then once you take a deep breath, kind of pull back, you kind of see, oh, it's still me. I just have this issue going on, and that's where I need to be right now. So, yes, it's I can get to say there. That was perfect, actually. That's what I want to hear. Because I think that people need to hear that too. As the supporters and stuff, and maybe it gives someone a little bit of insight. But it's funny enough when I have Leon here, he's been a friend of mine for a long time and been with me through the cancer stuff. And it's so funny. He's always asking, different questions I don't ask to people, because he's like, man, I didn't think about it that way, So it is nice to kind of get some words out there for supporters and people that, have someone with cancer in their lives, just to know, hey man, we all can do better, at the end of the day, I think a little bit. So,
and I think it's okay. Especially the closer the friend, I don't know, even, I'm thinking about, does it have to be a close friend? But if you know someone well enough to be hey, do you want to talk about that cancer thing? Or do you need a break? I think so many times people would really just appreciate of something I often say with folks after the cancer diagnosis is from a book I just love called The Last Lecture by Randy Pausch. Just a phenomenal, philosophy of life of kind of carpe diem. He's a person that had pancreatic cancer and kind of wrote about his experience and all. And he said, when there's an elephant in the room, introduce it. And so I think sometimes just being like, hey, do you want to talk about that? And if you don't, do you mind if we talk about like that last Chiefs game in Denver?
Yeah.
Oh my God. Right?
Yeah, exactly.
A lot of times that just eases things for people. So yeah, I would say as if you're someone with cancer, it's okay. Like, please tell the people around you your comfort level. And if someone is going through it, it's totally fine to bring it up and just ask, like, how much do you want to talk about this, or do you need a breather? And I will not bug you. I'll just, I do think there's more messaging, and I love this for caregivers and for people. Just be like, show up and be active. You'd be like, do you want to talk about it, or do you want me to like bring over a pint of your favorite ice cream and we'll just like watch Mean Girls?
Yeah.
Yes.
That's what I told people. I'm like, hey, let's just kick it, man. Let's just kick it. Let's watch some football. Let's watch some basketball. Let's hang out. Let's watch a game. I just want to be. Let's be friends. Let's be what we've always been before. Nothing different. So you kind of already touched on this a tad bit. Sure. If there's more to it, then I guess allude to it. If there's not, then that's fine. What made you kind of choose oncology therapy as a specialty, kind of going into that, exact realm? Anything specifically, or just what you already kind of alluded to begin with? Yeah.
So, I've always been like on the edge of like how much to share about this, but I do think it's like important. So, my mom is a cancer survivor. So she was diagnosed with breast cancer when I was a senior in high school. So right before Christmas, my senior year. And so that impact, and I had some other people in my life, like growing up, who'd had cancer, but obviously like not that close. So I definitely saw what things looked like for her, though I was still on the outside. And I knew kind of as a young person kind of going through that and that fear. And I already had a little interest in psychology, but so I went off to college knowing I wanted to do psychology, but I hadn't really been exposed to the concept because I'm from a small town. Like, my mom had to just go through it, and she had a lot of support in the community and friends and family. There was no one to go to who did that job, So I think I kind of witnessed some of that, and then went on, and she was doing great. She's, it'll be 24 years next month that she was diagnosed. Like, that's insane. Right. Yeah. And you just me a little there, but it's it's amazing. She was a stage 3 cancer patient.
And I mean, that was not that's also
years ago. Yeah.
4 years ago. That's something you don't hear a lot, because nowadays, breast cancer, they have it, so they're just doing so well with that and the research and everything. But 24 years ago, that was you got the diagnosis. It was not like, hey, it was a whole different ballgame. Yeah. I mean, it was very scary.
Definitely. So. No, it was very scary, scary for like it to come back or things like that. And so so I think that experience really shaped at least my awareness about like what that cancer realm looks like, what it really felt like from the family perspective. And definitely, and I was not a great cancer supporter to my mom, though, at that time in some ways.
Yeah, I mean, you're a high school student. I mean,
right. Well, and our motto, I was an athlete growing up and was like, walk it off and stuff. So not that I expected that of my mom, but I was like, I have to be quiet about how I'm feeling and how afraid I am, because she's got all this. And so I can remember being like, trying to act like everything was completely normal around her. And then I would go with like my best friend. We'd go to, because I'm from a total small town move, right? We'd go to Sonic.
Oh yeah, Sonic, yeah.
Right? Get a big drink and drive around, and I would cry or talk to him about it. And but I was like, I'm never going to cry about this in front of my mom because she's got too much going on, which is so silly. But now when I have people who have teenagers who are like checked out, I'm like, check on their friends and I would go like my best friend's parents, like I would talk to them. Yeah. It's like, check with those, my coach, like my volleyball coach, like check with those people, because
they'll let you know
where your teen is leaning on, not because they don't care, but because they don't want to burden you. And so that experience, I think, really shaped, and then going into psychology, like I said, I became in my undergrad and my master's program really interested around trauma, of like how you could have like kind of going through life and then have this awful thing happen, be it cancer or violence or military service or whatever. and then your mental health be impacted by that. So like, how could this like experience in the world change your brain?
Mm-hmm.
So I got really interested in that piece. And then it was kind of in New Orleans where things kind of lined up, and it was like, oh, I hadn't really considered, even though I had experienced that trauma kind of right on the sideline.
Yeah.
And put it together. And then I think getting to witness such a lovely group, and the therapist that was running it did such a great job that I was just like, wait a minute, I can do both these things.
That's where I want to be.
It's so awesome. Yeah.
Yeah.
And I know, and I mean, I have friends who do all kinds of different jobs, and colleagues who do work at, like, I don't think I could do child psychology. I could, you know, I have a friend who taught middle school math, and I'm like, I don't know how people look at me and go, you work with cancer patients. I don't know how you do it. And I'm like, it's amazing. I love being alongside them. Yeah. It's the right fit for me. There are so many things I could never do though. So, so I think part of it is it was just such a good fit. I sometimes tease that I'm a glutton for like deep conversation. And so I am really blessed or lucky and very honored to be in a position where I get to have a lot of really deep, meaningful conversations with people. And so, yes, while some of them are heavy and hard, not all hard things are bad things. And so it's just a really rich experience to walk alongside people. And I love it.
I agree. I think you do. I mean, I'll agree on the deep conversation. Probably when we talked the first time, we met for lunch. I'm like, you know, I was going to go meet someone for the first time. You know, we blabbed on. I'm like, man, we were talking way too much. I'm like, the whole off the rails conversation, which that's how me and Lee talk all the time. We will start talking, man, and 20 minutes later, we're talking about two different things over here. It's like, what are we doing right now, man? So I do get that, and I think it's awesome. I do agree. You're in the right spot. Every country we had has been great. Every time we talk, it's been great. So I appreciate you coming on here.
I'm so excited that you guys are doing what you're doing, because I feel like I have had these different experiences and, you know, been alongside a family member with cancer, done all this training in psychology, you know, walked along so many patients to be like, hey, to a foundation that's like really focused on the mental health side of cancer. I feel like in a way, maybe I would be preaching to a choir, or like, it's hard to get the message out more broadly, but coming from a patient, coming from a young person, from a guy too, because I know that's shifting, but, you know, traditionally, you know, a lot of men were a little 100%. Bit more hesitant to go into therapy, go into looking at that. And we're socialized not to let your emotions, you know, boys don't cry and all of that baloney. Yes. And so I just want to applaud you really on getting the message out there, making it accessible, and saying, hey, all your cancer stuff that's going on is important, and your mental health is just as important. And I'm guessing anytime you talk, it's kind of a no-brainer, right? Like, no pun intended, but for some reason on the medical side, I think there's a shift in that. It was like insurance companies or health systems or other people they were just like, give the chemo, give the radiation, do the surgery. Yeah. Like, that's a human. And they're going to have a lot. So just keep like, I wish I could buy you 1 million megaphones and just be like, keep telling people.
We're doing it. We're doing it. Yeah. We'll keep pushing for sure. That's always the goal, and we'll keep doing our thing. Thank you so much for coming and talking to us, everyone. I have 4 quick questions for you. They're not serious, but I got to ask everybody these 4 quick questions. So I'll write out 70 and sunny out. What are you doing?
Oh, I'm going for a long walk for sure. Okay. For sure. I love maybe with a friend, maybe with a good podcast, maybe with a good audiobook or a playlist. But if I can be out and moving and be outside, yes.
Okay, got in the walk. I've heard the walk twice now. I get it. I understand completely. I'm probably golfing, but I get the walk thing completely. I'm all about it. You know, wife would say walk too. Yeah. Late night, want to grab a snack. What is it? Out of the cabinet.
Chocolate, 100%. Probably dark chocolate.
Yeah.
Some kind of chocolate. I'm a sucker for a Reese's peanut butter cup. Also.
Oh man, yeah.
Especially if they're cold.
The Reese's is the peanut butter cup better than the eggs in the trees? Are the eggs in the trees, especially, are they better? I think they're better.
So my best friend and I are both like, we've known each other since we were 14. This is an ongoing. It has to do with your preferences, right? This is like deep dive into Reese's philosophy of your preference around the peanut butter to chocolate ratio.
Because it is different. It is different.
Right. Every one of those products, the peanut butter to chocolate ratio. I am actually, they're way too rich that I have to be like, it's a special treat. But the big cup is my favorite because it's like the most chocolate and the most peanut butter. Like the big ones.
Yes.
I do like the trees and the eggs. I think the eggs are original. Now they have like footballs and pumpkins and you know, all these different things. It for me, because I'm a chocolate person, kind of equal to the peanut butter. Those have a little less chocolate, so I love it as well. Okay. So yeah. It's just a ratio factor, but I would never turn any of them down. Let's not kid ourselves.
It's fair. If there was a movie about you, who would play you in the movie?
Oh gosh.
I know. It's a good one, huh?
It is.
I got John Krasinski. That's what I've gotten so far.
Oh yeah, I totally could see that.
I like that.
You know, I feel like well, two people come to mind, and it would probably be like if there would be a meld of people. Like I love Jennifer Garner. I could totally like. Okay. That's probably like aspirationally, like she would tell the like more dramatic, like beautiful version. And then because I'm like a comedic, I love comedy. I'm a comedian at heart, and I just love like goofball stuff. Kristen Wiig would probably be like way more my spirit animal.
I was just like a Sandra Bullock, maybe. You know, is that like fair? I don't know if that's
funny. So maybe she'd be a good. I like that. Yeah.
You know.
But yeah, total Kristen Wiig goofball. Like I goof with my sister all the time. I'm like, it's so surprising. Like all her characters from Saturday Night Live. So yeah, I'd say Kristen or Sandra. She'd be good because she's got some comedy chops too.
Yeah. With Congeniality, you know, she was good.
Yeah. Oh yeah, that's a great movie. Yeah.
Fair. And then last one, vacation. Where are you going?
Oh my gosh.
Go anywhere in the world.
That is tough because, like, I have so many places I'd love to go. I would really like to go to Switzerland, Austria, like see the mountains. I've never been there. I got to go to Canada to Banff earlier this fall with my sister-in-law and brother-in-law and my husband, and it's, I mean, so beautiful. You're like, how can this place be a real place? So
we went to Glacier.
Yes.
So we went to Banff technically. So we went to Glacier. So it's just, you know, on the other side of the border. And it is, I mean, if that's what Switzerland is, that's what me and my wife said, that's what Switzerland is. And I need to go there because it was so gorgeous. I mean, it was just, oh my goodness. I mean,
that's exactly like, I like a good beach vacation.
Yeah.
But there's something about the mountains that just.
When they're like that too, when they're just, everything, it's just, it's wild.
Yeah. So I would probably say, most beautiful place I've been probably is like Banff or the Canadian Rockies, which, like you said, north of glaciers, the kind of same deal. And so, yeah, wish list would probably be like Switzerland, Austria, Alps.
Fair. Like it. Fair.
Awesome.
Well, with that, Meagan, thank you so much for coming on. Appreciate you. And I'll do it again sometime. You know, maybe.
Yes, definitely.
Yeah, talk some more. For sure.
Yes. Thanks so much, Jordan. It was great.
Yes. Thank you. Appreciate you. Thank you so much.
Yep. Bye.
Yep. Welcome back. What interview. That was fantastic. I think she had so much insightful information on how she handles patients and supporters that come in that are dealing with cancer. I think it is a very different avenue in therapy. And we touched on that a lot during that. It's not just, you know, you're running the mill therapy and there's so much different types of therapy. People, you know, everybody goes therapy for different reasons, and cancer and oncology is a very specific one. So it was really great to have her on here and get to listen to her talk about everything. And we really enjoyed it. Both of us kind of sound sick in the interview. I think we touched on that. I'm still sick. I've been sick for the better part of a month and a half, I think. They actually found a lung nodule. And as a cancer survivor, you don't want to hear that because they usually think it's cancer. Thankfully, after a biopsy that was pretty short, pretty quick, they found out it was just a lung infection. So, I mean, one time in your life, I guess infections are a good thing. So happy to hear that news and glad we got the interview in. And I hope we have more to come. So with that, guys, thank you so much for joining us this week, and we'll talk to you very soon.